Welcome, everyone, to today's strategic dialogue, Practicalities of Partnership Building. This special strategic dialogue, hosted by Concordia, the University of Virginia Darden School of Business, and the U.S. Department of State Office of Global Partnerships, represents the culmination of months of hard work by our P3 Impact Award finalists. I'm so thrilled to be welcoming everybody to this special learning session and the final stages of judging for the 2020 P3 Impact Award. My name's Hanne Dalmut. I'm the Senior Director of Partnership Development here at Concordia, and I'm joined by Professor Margaret Frank from the University of Virginia Darden School of Business and Connie Tzioumis with the U.S. Department of State Office of Global Partnerships. Before we get into today's session and really turn over to the P3 Impact Award finalists to present on their amazing work around the world and offer opportunities to the judges to ask final questions to assist them in their evaluation, I'd like to turn to both Margaret and Connie for just a brief review of why we do this award each year and why we partner as institutions in our efforts to support that partnering ecosystem. Margaret?
So I'm Margaret Frank. I'm a professor at the Darden School of Business at the University of Virginia. And what we've seen in practice and in scholarship is a dramatic growth in interest regarding this cross-sector collaboration across the economy. And that's been actually happening since the beginning of the 21st century. So 20 years we've been thinking about this. But if you look at a lot of the literature on this, it's all about trust and governance and alignment. I think that the next frontier of this is about how. We've got to push our understanding beyond trust and governance and alignment and think about how we create economic value and social value together. The how is going to be the important part. The problem is, how do you express the how? Well, that is what you all have done. That's what the participants do, whether they're applicants or finalists. I just want to thank you all for contributing to our knowledge to push that next frontier forward to get us to the how, so we can create great social and economic value. Thank you. Connie?
Thank you so much. I'm Connie Tzioumis. I'm the Director for Partnerships in the Office of Global Partnerships at the U.S. Department of State. And it's a real honor to be here with you all, with our finalists. They're doing incredible work, especially in these really trying times. We've been working in close collaboration with Concordia and UVA Darden for a number of years. And I think a number of you might be asking, well, what does the U.S. Department of State, what is their stake in this? And what we've been finding, alluding to what Margaret just said, is that the trend is showing us that what we used to do in government and what we still do in terms of diplomacy and development is being done more and more and more over the years and over the decades by our friends in the private sector. And when I talk about private sector, I mean private sector writ large, not just corporate entities, but not-for-profits, not-for-profits, universities, you name it, the entire spectrum of what is out there. And it's more of a humble recognition that what we want to achieve in our international goals in diplomacy and development, we can't do on our own. We really need to work across sectors with our private sector friends in close collaboration. Part of the reason why we're in this too is to understand what is being done out there. What are the trends? What's working? What's not working? And so, especially in these times, it's really heartening to know that the hard work of partnerships, and it is hard work, it's not easy work, that the hard work is being done, and it's being proven here today, especially by the bright lights that are being shown on our friends here in this session today. So thank you for having us here.
Great. Thanks so much, Connie and Margaret. I think when I think about the partnering ecosystem and public-private partnerships and how they've grown, you just always think about that bumper sticker. It takes trust, but the how, the why, especially in a digital environment and in a very difficult environment by which to be navigating on some of these complex issues. We've solved the easy ones. Now we're working through the really hard stuff, right? That concept of trust, that concept of engagement, of collaboration, that's what these finalists are truly representing, and they offer so much learning for us. I will also acknowledge that we had amazing applications from all around the world that didn't make it to today's conversation, but they were still extraordinary, and we learned so much from them. And so we wanted to also acknowledge and thank the semifinalists and the applicants who came and shared with us their work. And we are always at Concordia, at Darden, at the State Department, always just so excited to receive these. It's a hard news cycle right now. And when I get a little bit depressed, which happens more than I would love, I think about these applicants and I think, oh, there's something truly extraordinary happening in Iraq right now. There's something really amazing in Equatorial Guinea. And so it gives me hope and heart. So that's what I hope all of our viewers today are able to see with these 5 finalists. Without further ado, let's kick it off to the first one. We'll be showing the partnership for Asili, an Eastern Congo initiative, and starting with a video.
Takwindia Batumiki Celestine. Ninazaliwa Kashunguri Premier. Niko marie, niko na watoto wawili. Kashunguri ni lokalite ya tangu zamani, lakini ile lokalite ilikuwa inakosewa na vitu viwili. Maji ndio ilikuwa ya kwanza. Ya pili tulikuwa tunakosewa na kituo cha afya yenye inaweza kutupatia madawa za mzuri.
In 2013, when I was the USAID mission director in the DRC, I worked with Alight and others to set up Asili. By providing clean water and health care on a fee-for-service basis, Asili has improved the lives of over 100,000 people, and local farmers are now selling their coffee to American consumers. What was just a dream 7 short years ago has become a reality, and Eastern Congolese are on their journey to self-reliance.
I'm Jocelyn Wyatt. I'm the co-founder and CEO of IDEO.org, and I've been part of Asili's journey from the very beginning.
My name is Abraham Leno, and I'm the executive director for ECI. I have been with Asili since it began in 2012.
Tad London, I'm the product manager for ECI, and I've been working on Asili for the past 6 years.
Partnerships lead at IDEO.org, and I've had the great pleasure of working with the Alight and Asili teams over the last 4 years.
The biggest difference with Asili is the quality difference. I think the humanitarian aid sector does not focus on quality, does not focus on human-centeredness. They focus on service delivery at the minimum level of quality and cost. And Asili has found a way to both deliver really high quality services at an affordable cost in a sustainable way.
That's why we talk so much about consistency. And for us, consistency is not only ensuring that that day-to-day quality level is there, but actually for generations to come. And that's one of the reasons that it was so important that we engaged this much wider set of actors.
Asili is a great example of a case where the private sector meets the public sector, meets the NGO sector and the community, and all 4 of those entities are equal partners in creating the solutions. This partnership is so valuable because of the trust that it built. These players came together, but really the power was in the hands of the community to lead. And so in a community that's been pretty disillusioned with international aid in the past, I think that's really powerful.
So Asili was created as a way to respond to some of those things.
Tangu nilipojua Asili, kungambo ya maji kushakuwa miaka 4 mimi nashotaka ile maji. Na kwa leo tumeshota maji ya Asili, tunaitumikisha, tunaikunywa. Donc inatusaidia kwa maisha yetu.
Asili offers a set of services in water. What is important with this is that there is a contribution from the community. They pay for the services. Asili also offers services in health.
Nous avons un système de membership ou d'abonnement. Ce système-là permet à notre communauté d'avoir accès à environ 100 litres d'eau ou 5 bidons par jour, mais aussi d'avoir accès à des réductions au niveau de la consultation. À part cela, nous tenons à ce que nos cliniques se distinguent. Nous insistons que nos bâtiments soient propres et spacieux pour le confort des malades. Voilà un peu en quoi Asili est différent.
And we've done all of this with the principle that there is not a single thing that we will ever build in Congo that we ourselves cannot use.
Yenye nanibanaka kuroho ni encadrema ya mzuri. Asili haina ubaguzi na ndio maana nishachagua ile kitu.
We are in a very, very exciting moment in Asili. We have tried out our ideas along with the energy and goodwill of the Congolese people. We are very excited for the opportunity that Asili has created, and this is the excitement that we want to continue. And the Congolese people, they are fun to be around. That's what makes it possible. Because they had idea.org, they had this idea of human-centered design, and they have developed it so much. And we thought that this was something that spoke to us largely. So we invited them into Congo. They did a social research. It took us about 2 years actually to start implementing anything on the ground, which was unlike the way that communities see activities come. People have a proposal and, okay, this is the activity we want. No, we spent our time sleeping in these communities, waking up in the morning with them, seeing what is their life, looking at what are the challenges, but also not just the challenges, what are the opportunities that they have to solving their own problems. Now, that led us into doing a market research, because we have in this human-centered design, there are 3 components. There is a viability, there is a desirability, and we looked at the viability component as the initial thing that we have to first ensure, because the activities that we want to create, we don't want them to be projects that end when the funding ends. So the market research helped us then to know what is the buying power of the community, what is the desirability for them to have these services, so that whatever we create will be able to last beyond any kind of funding that we put in. The community will be able to sustain it itself. Now, coming back to the other partnerships, which is either the public sector, government, the US government, or the Congolese government, they have always desired to find solutions to problems. They just, sometimes we struggle over 40 years of doing this, some organization or institutions, we struggle to see what is the new thing we can do that will, move the needle. And so we presented them with an idea like, hey, let's start from respecting the community. They are the experts. They know what they need. And for the private sector partners, what we also noticed is that what they really wanted is more than just a relationship that is around funding, around cutting me a check. People want to invest. They want to invest in the legacy that they will leave behind for their families, for themselves. We noticed that they want to give more than just money. So some of the partnerships we have found has helped us, either in logistics, like a mining company giving us their logistics to start a new road into a village, or buying some of the agricultural produce that we have been able to harvest with farmers. So these are some of the ideas that we have gone around to be able to create our own to co-create this idea of Asili using this form of partnership.
Hi, Abraham. I'm Chris Schwabe. I'm the CEO of Medical Care Development. We were among the partners who were the P3 Impact Award winners for last year for the Bioko Island Malaria Elimination Project. So it's great to, your project's very exciting, very unique. Could I ask you to speak a little bit more about the issues of access and affordability to the services that you're offering? You've talked about doing market assessments and meeting the needs of the local population. I'm interested in the level of coverage that your program is being able to achieve, and how you're addressing any individuals who are unable perhaps to pay, and if you see any role for the public sector in that regard, with or complementary to ACILI in the future.
Thank you very much. So the way we have looked at access is in two areas. You rightly mentioned those who can pay. So we, social research and market research have been able to identify what is the market price for the services or the products that we offer, whether it is in health or is in water. But also we look deep down into the community, and during the years of research that we had spent with the community, we noticed that yes, there is a percentage of the population that will not be able to pay for those services, at least for a number of years. And that calculation, the way that we did the calculation and that research helped us to understand it was around 10% of our population. So now that became a kind of an easy problem. Usually international organizations, we go in to solve for 100% of a population, but now we have 10% to solve for. So we went around creative ways. How do we solve for the 10% and that cannot pay while we have the 90%? So one of the ways that we thought was to create what we call a TPP, a third-party payer system, for those people who cannot afford to pay the prices of the services that we currently offer. And how do we fund for that? You will be surprised to hear that actually most of the funding for these TPP members have come from Congolese themselves. It's come from people like drivers, people like, other staff members within our own team who can afford, because the price is there. So they say, okay, if a clinic visit is only $3 and I am paid maybe $200, I can afford to pay that for myself. This is also one of the ways we wanted to create.
If I might jump in here, I think that ties perfectly to the value proposition and the way you engage the community in designing this partnership. The community is coming together for it. We are going to have to move to the next presentation. And so with that, it's my pleasure to introduce the iBank of Ethiopia and its presentation video, and we'll move to then a Q&A with their partner representative, Patrick Emery. All right, everyone, enjoy this next video.
Thank you.
Good morning and good evening, everyone. Thank you to the esteemed panelists for having us here today. My name is Menen Ayalio. I'm the medical director of the iBank of Ethiopia and cornea surgeon in Addis, Ethiopia. I'm here with my colleague, Mr. Patrick Emery, who is the vice president of Asia in Ethiopia for SightLife. Today, we will talk about a partnership that has transformed cornea care in Ethiopia and which serves as a shining model of collaboration for scalability throughout sub-Saharan Africa. More than 3% of the global blindness burden is right here in Ethiopia, but unfortunately, it's 7 to 91% of blindness and low vision in Ethiopia is avoidable. Of avoidable blindness and low vision in Ethiopia, 7.5% is attributed to corneal opacities, for which corneal transplant remains the primary sight restoring procedure. And this is the focus of our partnership. Corneal transplant requires access to a trusted source of corneal tissue, which must be donated from a recently deceased individual, meet quality standards, and be transplanted to recipient within days of donation. However, the global demand for cornea tissue far outpaces supply, and the lack of affordable tissue in Ethiopia was the largest barrier to cornea care. With limited government support, minimal public awareness, no other functioning iBank in sub-Saharan Africa, and a global cornea shortage, Ethiopia was ill-suited to develop the health system in ways that would meet the needs of the millions of cornea blind waiting in darkness.
With no solution in sight, NGO and government leaders in Ethiopia began discussing solutions. We knew the solution needed to be rooted in sustainability, particularly the UN Sustainability Development Goals of no poverty and good health and well-being. Growing local supply of high-quality cornea tissue in Ethiopia to overcome the largest barrier could not be accomplished without wide-ranging support. Thanks to close collaboration among NGOs and local leaders, it was determined the Eye Bank of Ethiopia, originally founded by Orbis International, could be scaled to meet national demand, could prove critical best practices in the region, and serve as a focal point for development across areas of the health system necessary for cornea health regionally. The partners who came together to realize this dream included, first of all, the Ethiopia Ministry of Health, which brought wide-ranging policy support to the most important policy underpinnings of the initiative. SightLife, the world's largest eye bank, brought technical expertise and sustainability consulting for eye banking, as well as their health system approach, including advocacy, prevention, and clinical training. Himalayan Cataract Project brought a vast training network, including short and long-term fellowships for Ethiopia cornea surgeons, which includes trainings on-site in Addis and collaborative trainings in the United States and Nepal, resulting in HCP training more than 50% of the corneal surgeons in the country. The Eye Bank of Ethiopia, of course, brought connections across the government, NGO, and community stakeholders, as well as commitment to corneal blindness that ultimately resulted in such a strong collaboration.
And as a result of this collaboration, the Eye Bank of Ethiopia Elimination of Corneal Blindness Partnership is able to meet 100% of the current demand for quality certified corneal tissue in Ethiopia, has procured 3,894 corneas for transplant, received international quality certification in accordance with the Eye Bank Association of America quality standards, and is poised to gain permanent sustainability funding by the Ethiopian Ministry of Health within 18 months, and is positioned to become an eye banking training center for sub-Saharan Africa. Additionally, the Eye Bank of Ethiopia has proven the concept of broadening eye banking purview from traditional eye bank operations to become a catalyst for local eye care policy across the corneal health system. As a result of coordinated partnership efforts, the first national donation policy has been established. The cultural concept of cadaveric donation has been embraced by the community, a first for sub-Saharan Africa, and the Ethiopian Ministry of Health has added cornea care to the national health policy, and eye banking has been established as a sustainable profession in the country. The policy adoptions and steady supply of high quality tissue by the Eye Bank of Ethiopia partnership has enabled the partnership to further expand scope to include clinical training capacity. The partnership has trained 9 cornea surgeons through short-term and long-term fellowship programs, including training Ethiopia surgeons in Nepal, USA, and on-site in Ethiopia. To further bridge the gap, the partnership has provided cornea care equipment, instruments, and consumables to surgeons nationally, all of which rely on locally sourced tissue from the Eye Bank of Ethiopia. Thank you for your support and recognition of our work. That is so important for the future of eye care in Africa. Thank you.
Thank you so much.
Hello, I'm Dan Vermeer from Duke University. Patrick, good to meet you, and great to learn about the Eye Bank of Ethiopia and the fantastic work that you've been doing there. I'd like to kick off our Q&A session to address the question of scalability. It looks like you've been very successful in a kind of a multi-pronged approach to develop the capacity for delivering these services in Ethiopia, but you also have an aspiration for becoming really a center for the rest of Africa. And the question of scalability is always a challenging one for organizations like yours and for these kinds of efforts. I wondered if you could talk us through the steps that you see being required. How do you engage? Do you engage with the practitioner community? Do you engage with the local communities themselves? Do you engage with the policy apparatus? How do you think about the question of scalability as you look beyond Ethiopia?
Well, thank you, Dr. Vermeer, and thank you to all the judges for having me here today. The foundation of our scalability plans are really tied to policy. We believe that if we can ensure access to donors through enabling national donation law that prevents liability from eye banking and in the future potentially organ banking, ensures access to reimbursement for surgeons that can help them to scale up their clinical practices, as well as access to patients and scaling up prevention programs to help identify cases in more rural areas. We believe that the numbers of patients coming forward who are, some of them even identified and treated before they progressed to corneal blindness, but the patients who come forward for treatment will significantly increase, which will drive up the revenue generation, which comes from processing fees that build sustainability within the eye bank. As the eye bank is able to generate revenue, then they can provide a larger portion of their services free of cost, increase the capacity of their staff, make eye banking a true career within the country, and in time, through the spreading of policy best practices in sub-Saharan Africa, enabling eye banking in other countries, and in the early stages, the Eye Bank of Ethiopia can be a provider of tissue to sub-Saharan Africa, assuming that all the needs in Ethiopia are already met.
Great, thank you.
Hi, Patrick. I'm Katherine Neebe with Duke Energy. Thanks for sharing more about your program. It's really exciting. A question that is on my mind, and I'd be curious about your reflections, is during this time of COVID, there's been a lot of interest on and emphasis on supply chain disruption and a desire by many to think about sourcing domestically and more locally. And I know that your program is able to meet 100% of demand through local sources. So I'd be curious about, as you were structuring the program, how you navigated that, how you thought about it, and what you're seeing and reflecting upon now.
Oh, thank you for the question. So many of the best practices within our program are based on US best practices, particularly the Eye Bank Association of America. The Eye Bank Association of America is able to meet all of the tissue needs in the US and elsewhere. And as we've applied those best practices for scalability, professionalism, and reimbursement, we've seen, like you said, the fully meeting the local demand. COVID has certainly changed the dynamics, and actually we've seen a significant decrease in the number of patients who are coming forward for care. So that is certainly resulting in higher supply and actually lower demand than what we would typically see. However, we are expecting that trend to continue in the country as the eye bank grows, but patient identification is not. And that's just one reason that we really need these policy enablers that will start to increase the demand. At this point, the supply is already being met, and at times it's oversupplied.
Hi, Patrick. This is Chris Schwabe. Really great program. Could you clarify for me how the costs of the tissue processing and corneal surgeries are being shared between consumers, private financing, and government subsidies, and whether you see this model as a solution for universal accessibility to all the Ethiopians and possibly to other African countries, sort of independent of perhaps ability to pay?
Thank you. So the current model is a blend of financing from the government, which is a bit unstable funding at times, but it's a blend of money from the government, international NGOs, as well as local organizations, community organizations in Addis Ababa. However, there has been a significant change in the past 3 or 4 months where the government has committed to provide permanent long-term funding. And this is the result of an identification that without the stable funding and uncertainty about whether international funding would continue, the government did need to recognize that they have a world-class eye bank, and they have to they have an opportunity to build sustainability into the existing national healthcare plan. And so through the advancement of the health policy, which looks at the entire health system approach around cornea, the government has committed to long-term funding. We're waiting for the institution status, which would provide the funding that is similar to the funding that is given to local hospitals such as Menelik Hospital in Addis. As far as the surgeon reimbursement for cornea transplant, the government is currently funding a percentage of that, and in those cases, the corneas are provided at low cost if the patients cannot pay. But the surgeon reimbursement is an area that will be an additional focus for policy development.
So interesting. Thank you, Patrick, and the judges. It sounded like policy was really key to unlocking the next steps for this amazing partnership. And I think it's great to see that perhaps the last conversation really centered around the role of the community and individual payments. And then this one is more about blended financing and government support. And that is a perfect segue into our third finalist video, which will be featuring the Inter-American Fund and Mott Foundation partnership in Mexico, and really talking about the future of philanthropy. So with that, let's kick it off with the next video.
Our goal in partnering with Mott was really to create a more inclusive and sustainable philanthropic ecosystem, one that could better support the work of Mexican communities. We didn't just want to help one organization solve one problem in one community. Instead, we wanted to create an environment where all communities could access resources and tools to carry out their own projects. Our partnership is helping to chart the course for community philanthropy across Mexico.
The Charles Stewart Mott Foundation has been pleased to support the development and growth of community foundations across the globe for nearly 50 years. We've learned that community foundations are one of the best tools to help meet local problems and solve them at the local level. Since 2012, the Mott Foundation has worked with IAF to build a strong and effective community foundation sector across Mexico.
We commissioned a forward-looking study that revealed the structural constraints facing Mexican community foundations, including legal limitations, staff turnover, insufficient training opportunities, and a lack of standards in areas like transparency and consistent financial reporting.
Our partnership invested in three main areas. One, seed funding to support community foundations in mobilizing local resources. Two, the technical assistance and training and grassroots development and grant making for foundation staff. And three, strengthening a network of community foundations, Comunalia.
So the Mott Foundation approached its partnership with IAF as a co-funding model. We both brought expertise to the partnership. IAF has deep expertise in the region, working with community partners and extensive capacity with grassroots organizations. And the Mott Foundation's program staff have decades of experience of working in community foundations and community philanthropy globally, and are very involved in supporting the program design, the development, and tracking implementation.
So for every dollar that the IAF Mott partnership invested, Mexican community foundations were able to leverage another $4 from local sources. This provided resources for over 230 grassroots projects, including small businesses, community gardens, and youth civic engagement programs.
Through our work together, almost 30,000 Mexicans from rural areas and some from urban areas have been able to tap into and leverage local resources.
The IAF Mott partnership has really enabled the transformation of the local philanthropy landscape in Mexico. We were there right from the start of the launch of Comunalia, a professional network of Mexican community foundations. We had nurtured it, providing support and connections with peers in other countries. And Comunalia in turn has strengthened community foundations, encouraged the mobilization of local assets, and invested in existing grassroots organizations.
Enduring sustainable development requires a strong domestic philanthropic sector. Sustainability for grassroots organizations is at the heart of this partnership.
For us, scaling the partnership does not simply mean replicating approaches, but installing three simple principles in philanthropy globally. 1, decisions are best made by those affected by them. 2, approach collaboration with local communities as a co-investment. Recognize the many assets beyond cash that communities bring to the table, like knowledge, capacity, and trust. And 3, recognize the power of networks to bring solutions to scale.
The success of our partnership with the IAF in Mexico has already given rise to a transnational network of community foundations and other partner organizations called Building Broader Communities in the Americas. We've also been turning to the IAF for advice on new areas of Latin America where we think community foundations can emerge and grow.
The IAF Mott partnership upends traditional power dynamics in philanthropy, putting community members in the driver's seat and centering resources at the local level. What makes this partnership special is that it's investing in the health of civil society and contributing to a healthy democracy in Mexico. Instead of focusing on solving specific short-term problems with sporadic funding, it's creating a favorable climate for the Mexican private sector, philanthropic sector, and civil society to partner with communities to create their own opportunities and solve their own challenges.
Great. So we are back, and we are joined by Paloma Adams-Allen with the Inter-American Foundation. Welcome, Paloma. I'm going to kick us off with the first question. So your project kind of indicates a different model for philanthropy and talks a little bit about disrupting funding on the ground, working with community foundations, and helping them kind of address the needs of local populations who they're working with. Oftentimes when you're working in communities at IF, you're talking about providing technical assistance or training. What about working with these community foundations has been different? And what type of criteria have you found that these community foundations kind of bring to the partnership that perhaps was surprising or that you didn't expect?
Thank you. Great to be here. Thank you to the judges and everyone else. And hello to our fellow partners, Amat Foundation Comunalia in Mexico. In terms of what we found the community foundations brought to the partnership, crucially for us, the IF does provide training and technical assistance, and we provide direct grant funding so that organizations can spend those resources as they feel they need. For us, what is most surprising about community foundations and what we thought would be potentially transformational, which is why we wanted to do this partnership, is that those foundations by design are of these communities. They're not based in capitals. They're not necessarily run by large established Mexican families. They're based in the different states across Mexico. So they represent those regions, and their leadership is made up of community members. The priorities they fund are decided by and influenced by the communities themselves. And communities, there's a shift in the power relationship where not only leadership, but the communities can invest. They give money to the community foundation, small businesses, a bakery, a local farmer can also invest in grassroots initiatives that they care about that are responding to the needs of their communities. So that was surprising, but that's also the potential we thought was there, which is precisely why we wanted to invest in them and really help strengthen them so that they can be have a bigger role in Mexico's philanthropic ecosystem, which is quite large and quite robust, but it is very traditional.
Thanks, Paloma. That was great. Let me follow up a little bit on that. Comunalia has a very important role in helping to organize this venture. Could you speak a little bit more about it, and could you talk a little bit about its sustainability and what percentage of its operating costs are they able to cover through fees in the partnership at this point, or are you expecting?
Thanks very much. So Comunalia is, for the rest of our colleagues, the umbrella organization, is a membership organization, and the 16 community foundations in Mexico with whom we're working and who are part of this partnership are members of Comunalia. Comunalia actually came after the existence of these community foundations, and so they're designed to be a support system really for these community foundations to enhance coordination between the foundations, to address any technical challenges foundations are facing, to help the foundations address problems as a group as needed, standardize indicators, etc. In terms of sustainability, the work that we're doing with the Amat Foundation now is really focused on strengthening Comunalia as an institution. And we've seen an evolution in that, in their strength, really, in their effectiveness, even over the last couple of years. And I'll give you two examples. The first is when the earthquakes hit Mexico in September of 2017, we immediately decided it makes the most sense to check in with the community foundations and figure out what communities need and work through those community foundations to support them. And they were very clear that, yes, they needed support on recovery and rebuilding. We initially thought, let's work with Comunalia. We'll set up a fund with Comunalia. Comunalia will manage it and work with the community foundations. Comunalia was at that point not ready to do that, didn't have the right leadership, didn't have the right systems in place. Today, with COVID-19 pandemic, Comunalia stepped up immediately to check in with the community foundations and communities, immediately launched a multi-donor fund, and has been mobilizing resources. We've made an investment. They are committing to mobilizing funding from other sources across Mexico. And so we're just able to see in real time that their capacity has strengthened in a couple of years in a remarkable way. In terms of operating expenses, I unfortunately can't answer very specifically that percentage now, but I can send that to you, no problem. But our goal is always to make sure that we leave these organizations sustainable.
Great. Thank you so much, judges and Paloma, and to this strong partnership that builds on the community value and community empowerment that model. So, truly excellent to see. With that, we will shift to our fourth P3 Impact Award finalist for 2020, which is looking at a new model of digital innovation and policy engagement for affordable medicine, an issue that is so near and dear to so many humans today. So with that, let's look at state affordable medicine in Ukraine. And after that, hear from Oksana.
Healthcare reform, which started in Ukraine in 2016, is accelerating for the benefit of 41 million Ukrainians. We're happy to share our experience in scaling up access to medicines through innovative digital solutions. In 2017, the government decided that each new stage of reform could take place only if the necessary IT tools were available. One of the greatest wins in Ukraine's healthcare transformation, the program Affordable Medicines, was launched to strengthen the role of family doctors while combating the most prevalent non-communicable diseases. With the establishment of the National Health Service of Ukraine, the program was upgraded to include innovative e-tools such as e-contracting and e-prescriptions to optimize the use of public funds, further increase access to medicines, and improve health outcomes. Launched initially using handwritten prescriptions and monthly paper invoices, now the new program offers an electronic end-to-end solution with clinical, operational, and financial controls. More Ukrainian patients with NCDs, primarily elderly and socially exposed, benefit with the help of mobile technology.
From the very first steps, the Ukrainian reimbursement system development, it was supported by the USAID mission in Ukraine as a three-step program where a patient visits the family doctor, receive a prescription, and a pharmacy dispenses medicines. In April 2019, the USAID SafeMed activities supported the National Health Service of Ukraine with the introduction of electronic prescription to complement and advance Ukraine medicines reimbursement system.
National Health Service, along with the Ministry of Health of Ukraine, set reimbursement prices for medicines based on the external reference price model. Manufacturers submit their price proposals twice a year to give the best price for the National Health Service and decrease patients' co-payments.
Doctors electronically prescribed ENNs, and patients who suffer from cardiovascular diseases, type 2 diabetes, or bronchial asthma can select their medicines at little or no cost in participating pharmacies relying on pharmaceutical care.
As a single payer, NHSU benefits from transparency and accurate forecasting. For the first time, vital decisions are based on reliable, real-time data. The introduction of e-prescriptions is a giant step towards achieving universal health coverage in Ukraine. Inspired by this success, Ukraine is moving forward, aiming to expand the reimbursement program.
The introduction of e-prescription was not the only change during the program shift to the NHSU, but became its most recognizable signature component, designed and implemented to support real-time data collection for the NHSU. E-prescriptions help provide better services to patients and healthcare professionals who use the reimbursement program and allow for more sophisticated budget control.
After 4 years of implementation, the Affordable Medicines program is now a household name in Ukraine. This serves as an example of transparent, government-led, public-private partnership initiative designed to improve access to medicines with a win-win for all participating stakeholders.
Since April 2019, patients began receiving medicine through e-prescription. It's easy, faster, and more comfortable. Doctors can e-prescribe even by phone consultation. So there is no need to visit ambulatory to refill your prescription.
A year after the introduction of e-prescriptions, more than 20,000 family doctors in Ukraine issue e-prescriptions, and each third pharmacy fills them for more than 2 million patients. On average, over 14,000 patients receive e-prescriptions every day.
As you see, Affordable Medicines reimbursement program powered by digital solutions, demonstrated benefits for all the actors. It is a solid collaboration between the state and business for the best interest of both patients and healthcare workers, and a giant step towards universal health coverage in Ukraine.
Good morning. We're joined by Oksana Movchan from the National Health Services of Ukraine. You have a very exciting program. The State Affordable Medical Program is really a unique partnership and strategy that leverages the benefits of being a government-run and publicly funded program with the inherent statutory, organizational, and financial benefits conferred by the government of Ukraine, along with the benefits offered by private and public pharmacies throughout the country, and the extensive expertise and global experience of MSH in the domain of drug supplies management. So congratulations on this. Could you give us a little bit more information on what percentage of the Ukrainian population with hypertension and maybe ultimately with other non-communicable diseases is or will be covered, or you foresee being covered under this program? And what kind of impact this program is, the costs of this program are having or are expected to have on the Ukrainian government's health expenditures as it relates to sustaining these fantastic social benefits?
Hello. Thank you, ladies and gentlemen, honorable colleagues. It's my privilege to speak to you today about the program Affordable Medicines. Thank you for this question. If we're speaking about the patients that you've mentioned, I would say that the program covers everyone who is in need. The approximate percentage would be around from 10 to 16%. We can check it later and send you this information. What was the second question? Sorry, the second part.
Was what the expected impact on the Ukrainian government's health expenditures would be, and whether that poses a challenge for the government, because it's a very ambitious program.
I can say that we increase from the very start, from the launch of the program in almost 1.5 years. We've been able to double the amount of money which is allocated for this program, and we are expecting to double it again the next year for 2021. So this program shows a very good impact. We have it coincided with the launch of the healthcare financing reform, and now we can say that we have 86% of family doctors and 82% of pharmacies nationwide who are issuing e-prescriptions. We also have, by today, we have 13 million of e-prescriptions that were issued to 2 million patients. The total population of Ukraine is around 40 million. We have 4,000 new patients receiving the medicines under this program each day. So we collect this information every day. The average age of the patients is 65, and some of the patients save up to 10% of their pension allowance that they receive as a pensioners. The errors related to the manual issuing of prescriptions is absolutely totally eliminated. So everything is in electronic way. We accept only electronic prescriptions, and we pay against the electronic data. All the data we receive are published, aggregated, and published published every month on our dashboard, so everybody can see and get the access to the data. And also these data are available in different formats, so that it could be used for forecasting, for analysis by different NGOs or other government bodies. By the way, last week we received the government award for the best digital solution among the government agencies of the year.
So we expect that this program will receive, the Ministry of Finance is speaking about the reform. It's also a reimbursement program coincided with the launch of the health financing reform. And we expect from the Ministry of Finance to support our proposals to increase the funding allocated also for reimbursement program and medical services payment, because of the we have the argument that we have because we have this proof that we are able to pay against transparent data. We're able to provide argument under each transaction, be it the reimbursement program or the medical services.
Great. Thank you so much, Oksana, and congratulations to the team for winning that award last week. That's when we saw and reviewed this application, it's truly a fascinating use of digital innovation, and so congratulations, well deserved. In keeping with this theme of making healthcare more of our daily lives and using new but also tried and proven ways of thinking through healthcare, it's our pleasure to turn to the final video and final presentation from the Wash Up partnership between Sesame Workshop and World Vision, really thinking again about how to use wash sanitation. So with that, let's turn to that video. Thank you.
I'm Sherrie Westin, President of Social Impact and Philanthropy at Sesame Workshop, where I have the enormous privilege of overseeing our social impact efforts.
And I am Edgar Sandoval, President of World Vision.
Edgar and I are so honored that our Wash Up partnership has been selected as a finalist for the P3 Impact Award. We've come together to address the greatest global health challenge facing children today, disease related to poor sanitation, water, and hygiene. And clearly, this is more critical than ever as children the world over face a global pandemic. Even before the pandemic, preventable illnesses like pneumonia and diarrhea were the leading cause of death for children under the age of 5. And not only are these diseases widespread, but they contribute to school absenteeism, increased dropout rates, and are barriers to children's healthy development. Tackling these systemic issues requires a unique partnership. Together, Sesame Workshop, the world's largest informal educator, and World Vision, the largest non-governmental provider of clean water in the developing world, have formed a powerful alliance to deliver life-saving wash behavior change education to children in 14 countries and counting. At Sesame, our engaging characters have the ability to teach children critical lessons, to model behaviors, and to tackle tough issues, always in non-threatening, child-friendly ways. That's why we created Raya, a very special Sesame Street Muppet. She's 6 years old, has long braids and a beaming smile, and she teaches children simple yet life-saving lessons, like washing your hands with soap and water or wearing your sandals to the latrine. By infusing World Vision's strong local networks and rural infrastructure with Sesame Street's engaging, research-based content, Wash Up is bringing children play-based materials, videos, and games to teach life-saving health and hygiene lessons in 30 languages, all with Raya and her best friend Elmo. And we know that healthy habits are contagious. Together, Raya and Elmo encourage children to share the lessons they learn, helping them become catalysts for the entire family and community, something that is more important than ever in times like these.
Thank you, Sherrie. At World Vision, a Christian child-focused organization, we want to empower kids to overcome threats like waterborne diseases so that they can realize their God-given potential. And we love working with partners like Sesame Workshop to broaden our impact. Wash Up is built on the principle that school-based wash interventions not only generate broad public health benefits that reduce the spread of diseases, but they contribute to outcomes such as school attendance and gender equality. That's how the program has the power to catalyze systemic change in alignment with the Sustainable Development Goals. And we have seen real impact, from raising awareness among children to national policy changes. Research shows that children who participate in Wash Up understand the risk of germs and demonstrate regular, positive wash behaviors. For example, in Afghanistan, Children refused to spread the tablecloth for meals until all family members washed their hands. And at the national government level, the Ministry of Education in Honduras and Zambia integrated the wash-up content into national preschool and primary education curricula. The partnership between Sesame Workshop and World Vision was born from the need for child-empowering programs that encourage good hygiene behaviors, especially for kids in fragile and ultra-poor communities where we work. Sesame Workshop has the unparalleled ability to create entertaining content that addresses stigmatized topics like sanitation, disease, and menstrual hygiene. And with our deep roots in communities, World Vision provides a platform of trust, understanding, and holistic programming through which positive behaviors take root. Together, with a little help from Raya and Elmo, we are laying the groundwork for lasting change that starts with kids.
Thank you so much, Edgar. And on behalf of Sesame Workshop and World Vision, thank you all for recognizing the impact of our Wash Up partnership and the potential to create lasting change for generations to come. We are deeply grateful for your consideration.
Hello, we have Sherrie Westin representing the Wash Up initiative, which is a partnership of World Vision and Sesame Workshop, focusing on water and sanitation and hygiene interventions in a large part of the globe. And I'm really fascinated with this partnership. For one thing, I think bringing together the kind of the culture and communication strengths of Sesame Workshop with World Vision's on-the-ground presence and technical expertise is a really obvious partnership. If it didn't exist, it should exist. My first question is, I guess, I'd like to address it in two parts. One is that water is so inherently cultural, and so you've developed culturally relevant resonant programming, and you're doing that now across many different cultures. And so I'm interested in how you adapt it across cultures. And a second sort of follow-on question, I'm also really interested to hear how you've had to adjust or maybe build new messaging given the pandemic and the importance of hand washing and hygiene in the context of the pandemic.
Okay, great. Well, thank you. Thank you so much for those questions. And before I do want to congratulate each of the other finalists, and more than congratulate, to thank them, because the work they're doing is so impressive, and we're honored to be and humbled to be a part of these other recipients. So yes, one of the things I have to say, Sesame Workshop is really good at adapting and creating content that is locally sensitive. I mean, I think people often think of Sesame Street as this domestic television show, but Sesame Workshop for over 50 years, I think the places we've had the greatest impact is where we go in countries, we bring in local advisors, experts, and we create content that is not only locally culturally sensitive, but it's addressing particular issues of that country. It's creating content that children can identify with, that resonates with them in their language, within their culture. And so that's critical. With the WASH work, I think what was so powerful about this is it was originally created with funding from the Gates Foundation, our first ever. And we created Raya, the little Muppet you saw in the video, specifically to be a health ambassador, to teach washing hands with soap and water, wearing your sandals to the latrine, etc. And it was in Nigeria, Bangladesh, and India. And there was, thanks to the Gates Foundation, there was an incredible amount of research that they also funded, which is always so helpful, both formative and summative. So we really understood what was most effective, not just in educating children about these important issues, but real behavior change. When a child learns at a young age, it's so important he washes his hands with soap or wears his sandal latrine, he'll keep doing that. And we go back and test 12 months later to make sure that's stuck. So when we created this content, it was such a tremendous opportunity to leverage the Gates investment by forming the partnership with World Vision. And thank you for saying that it is a smart partnership, because it is wonderful, because their skill set so complements ours. We create proven educational content. They provide more water than any other NGO, clean water. So bringing that together, the hardware, the software, that actual access to the water, and the education about how to make sure that water, that there are clean spaces, that they're washing hands with soap, etc. So when we go from country to country, we started in Zambia, and now in less than 5 years, we're in 14 countries with World Vision. So we're so proud of this growth and this scaling. But in every single new iteration, every time we go in a new country, we start again with formative research, going in and meeting with locals, making sure it's reflective of their needs, their culture. And I think if we didn't do that, it would not be as effective. So, and their second question was about, help me now.
Adapting to COVID.
Oh, COVID, absolutely. Okay, how could I forget? COVID has been a tremendous disruption for all of us. I mean, particularly for education, but for all direct services, because often the World Vision staff, where they have this tremendous infrastructure and knowledge and resources on the ground, would use our content in school settings and after school settings and home visits. And so many of those direct services have been shut down because of COVID. Many of the schools in countries we're working in are starting to open up again, but it's forced us to be more innovative. So we've had to use we're experimenting with WhatsApp to reach parents with COVID specific messages, as well as basic washing. And we have done kits, emergency hygiene kits that are sent home with children. And one of the most rewarding things is we find that the children who are the basic recipients of this content become catalysts for the entire family. So we're more innovative. We're using more digital radio, not television in these countries as much, but a basic phone. And I hope that those lessons will actually serve us well, even when we're back in the position to have direct services, because learning how we can reach children and families when they are in lockdown or in isolation is certainly something that's going to serve us well in the future as well.
Yeah, hi, thank you for that. It's really, really helpful and a great program to see. I'm really keen on this notion of children as change agents and as catalysts for change in their own families and in their own communities. I know we're at time, but I'm just wondering if you could briefly touch on what are some ways that you've seen children really kind of be the change agents that we know that they are in their communities?
Well, we do so much research to make sure we can measure outcomes and show that this is working. And we have seen where not just children test 23% higher in terms of now washing their hands after the latrine, or any number of different tests, but that the entire family has changed behavior. So I think this is designed to empower children, to help them feel that they can be the change agent. And, one of the things, because we knew Raya was reaching older siblings and mothers often in this content, we've even moved into menstrual hygiene, where we created an older sister for Raya, because we saw that it could be a catalyst to address other pressing water sanitation and issues, particularly because girls are disproportionately affected by those. And I think that's so important now too. With COVID, girls are going to be another real challenge in getting them back in school. The more we can address issues that can help empower girls during the pandemic and beyond, I think the more impact we can have.
Thank you, Sherrie, and to the judges. We know that when vulnerable communities leave school or drop out for whatever reasons, such as this pandemic, the likelihood of their return is much less. So it's truly critical that there's investment and focus on returning all people back to school and educational opportunities when circumstances allow. So I'm going to invite everybody to come back in, all of our judges, the judges are all here, but all of our finalists and Mary, Margaret, and Connie. We're going to use the last 5 or 7 minutes of today's conversation for a bit of a group discussion on some things we've learned, additional questions that might exist or still be out there, be triggered by some of the responses people gave, and really kind of just how do we round out the 2020 P3 Impact Award place? I will let somebody jump in. I do have questions if there's a pause, though.
Could I jump in with a question here for all? We just heard really nice explanation from the Wash Up partnership about how it's adapted to the COVID-19 pandemic. Could I ask all the partnerships whether they've been able to pivot in any way to actually address the COVID-19 pandemic within the countries where you're working, and how the partnership framework and who's in the partner has potentially facilitated this process, if at all? I'm thinking here about somewhat similar to what Wash just talked about. The water is kind of water as PPE, accessing COVID testing or medicines. Could you speak to that, perhaps?
Well, I can go. All right, I will jump in. For us, I think the way that we had built Asili, being in Congo, we really built for fragility, and this was a big test case for us. You know, this pandemic is global, so the effects are what we all feel around the world. And so in that sense, you know, once you had built with that in mind, you position your services, you position your supplies. So we do have a runway, but if this continues, for sure, it's going to affect some of the supplies and things that we had positioned. So this is where we are leaning. The biggest question in our mind is, how do we not sacrifice the business model, because it's important for our viability in the space of a prolonged pandemic? So these are questions that we are deliberating with our private sector investors, with our government parties, to see how do we keep the business running even during this.
Can I go?
Go ahead, Paloma.
Excellent. So in the very specific context of Mexico, COVID was actually a great test case to see whether the community foundations could respond quickly to a humanitarian crisis of this scale. And I mentioned earlier that Comunalia helped set up a multi-donor fund and is mobilizing resources, the majority of which will be local resources. And they've committed resources already, and the communities will be receiving small grants for particularly communities are asking for help around economic recovery. So beyond the immediate support that they received on PPE, locally prepared masks, support for food security, et cetera, they're now concerned about reopening businesses, getting goods to market, addressing logistical challenges in their communities, addressing gender-based violence, et cetera. And so this fund through Comunalia and this partnership is designed to get resources and support very quickly out to the communities that are struggling with this most. Beyond Mexico, we've had to embrace a similar model across Latin America and the Caribbean, which is pivot very quickly away from traditional programming, embrace flexibility immediately, allow our grantees to reprogram existing funds as much as possible, to use it for COVID relief, immediate, medium term, and now looking at future resilience, particularly around health and food security. And one of the things we hadn't anticipated, but a crucial piece which we're all learning, is the need for technology, right? And we work with communities who are physically remote, who are underinvested in, who normally don't have access, and we pride ourselves on getting to them personally, which we cannot do now. And because we're using organizations that are based in communities, that has really helped them be able to at least access those communities. And we've learned that pre-positioning equipment in those communities, telecoms equipment, phones, WhatsApp, you name it, has been really, really useful in helping them respond.
I just have a question. I'm wondering if any of you have faced the challenge. All of you are using the term community, and it's refreshing to hear the kind of user-oriented design focus that many of you have. But community isn't homogenous either, at least in the community that I've been involved in. So I wondered if any of you have gained insight into how to manage what are often quite, challenging tensions within a community about what the priorities should be, the tension between those who are empowered and have a voice in that community and those that are more marginal, and so forth. So I'd like to just dig in a little bit to this idea of community, and that it's actually much more nuanced and complex than we often give it credit for.
I can start. If
sure.
No one else. So the IF's, our mission is to, the Inter-American Foundation's mission is to surface and support the grassroots. So when we're talking about communities, we're really talking about grassroots organizations, farmer associations, women's co-ops, really small organizations who make up and represent communities that are generally historically marginalized or ignored, etc. And we are cognizant that yes, there can be tensions in communities and can be very complicated. And so a part of our criteria in assessing whether we will fund an organization is, are they actually inclusive of the community they're representing, whether it be a geographic community or it's a constituency, Indigenous peoples, Afro, Latinos, LGBTQ population, people with disabilities, are they actually representative of those communities? And crucially, are women and young people and people who are historically marginalized in their leadership? Are they going to be leading projects? So not simply passive recipients or beneficiaries, but active participants in leadership. And when the leadership is representative, we found that this reduces any tension because the group does represent the community that it's advocating on behalf. And so that's one of the things we look for to make sure that we reduce those kinds of tensions.
So building on that question, maybe Patrick, you could answer this question, which came from the audience around this idea of how collaboration really requires kind of trust. And we've talked about that already a bit, but this idea of sharing maybe intellectual property or proprietary information. How do you share, best practices, ideas, creativity when you're still trying to build a partnership? Because partnerships are built on this idea of finding that point of intersection, that mutual benefit, and it can take time. So maybe you can talk a little bit about that and in the context of the community you're working with.
So the IBank of Ethiopia partnership, we are very open with our intellectual property, primarily because we know that we cannot solve the problem alone in sub-Saharan Africa. We require additional IBanks and additional leaders throughout other countries to deploy the best practices that we have been able to prove work in a country such as Ethiopia. So by working with local leadership, local religious figures, as well as trying to gain some representation from neighboring countries and sharing those best practices, we are very open to sharing and very optimistic about the ability of these best practices to be scaled in other geographies nearby.
If I might add a little bit on this one too, because I will say in terms of this particular partnership with World Vision and Sesame, because of World Vision's relationships on the ground in the countries in which we're working, we don't go where we're not invited. So there is a real receptivity from this sense from the communities where we're working. And one of the other things I would mention is in several countries, in Ghana, in Zambia, and Honduras, we have been able to work with the Ministry of Education to adapt and include or integrate our WASH content in their pre-primary and preschool curriculum, which is a huge opportunity for us to scale, but also really does give you a sense of how welcoming that community is to have this content to be able to address this issue.
Thanks, Sherrie. Really appreciate it. It's good. Can you all see me?
Yep, we do.
Yeah, okay. Well, I just want to bring us to a close and thank you all for being here with us today. I think one of the things that I really walk away with that's been repeated over and over and over again is the importance of local ownership of these solutions and embedding these answers into the community. So if I think about, we've got sourcing of local products and manpower. We've got funding through local philanthropies. We've got building community-owned social enterprises. We've got organizing local pharmacies, and we've got training local teachers. All of that being really embedded in the community and therefore empowering the community to build a very sustainable solution. So that's really exciting to hear, especially in a time of a pandemic, when we're seeing how important our local communities are in getting us to that effort. And so I just want to offer my own thanks for you shedding light on these issues and helping us, as well as the rest of the society, really learn how to create economic and social value. Connie?
Yeah, thanks everybody. Well, what a privilege it's been to sit through and listen to all of you and to hear all the amazing work that you're doing. As I mentioned in the opening remarks, we in our office, in the Office of Global Partnerships at State, we're dedicated to the work of putting together partnerships. What we're doing here today is a public-private partnership. And so as I mentioned, it's not easy work. It goes above and beyond your traditional grantor-grantee relationship. It does require more effort. It requires constant communication, constant being attuned to, what your partners have in mind and making sure that your goals are aligned and everything. And so just by being here today, because of what it takes to put together a partnership, I know that you all are great people, because I know that in my own experience as a partnership builder and maintainer and all of that, you don't want to get into a partnership with anybody unless you actually like what you're doing and who you're working with, because of the extra work and because it's voluntary. Nobody's forcing us to put these partnerships together. This is driven by creativity and passion. And so I just want to thank you for that, and thank you for your company, and thank you for sharing your wealth of knowledge. From my part, one last thing before we sign off is I also would be remiss if I didn't mention that in my office, we recently launched a pilot COVID-19 partnership response fund. It's a $10 million fund. It's meant to be a pilot, and it is really meant to get people to apply for funds in partnership with us that address the impacts and the primary and secondary impacts of COVID-19. And so including, I think Paloma also referred to this, not just the social impacts, not just the medical impacts, but the economic impacts as well. So I will be sharing that information. It's a very simple link, but I'll share that with all of you. So thank you.
Make sure that our audience joining can get access to that information as well, because it's truly an amazing funding vehicle. So we learned today that there's a mass amount of technical policy funding frameworks that have to be aligned for this, but at the end of the day, you also have to be a good person to build partnerships. And I think that that is something we can all take forward. We can be kind and build partnerships. So tune in at 1:20 p.m. Eastern Daylight Time to the main stage to see who our final winner is. And just a huge round of applause to Mary Margaret Circle for all of these fantastic finalists. It's been a true pleasure to learn about your work and to be celebrating you over the past several months. So good luck, and thank you, everyone. Have a great day.